Good morning, and thank you for joining us. Today, I'm joined by Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the COVID-19 vaccine rollout, Dr. Carol Zimbalatti, Public Health Physician, to provide an update on the local COVID-19 situation. We have been busy this week with vaccinations. On Monday, we opened the doors to our first mass COVID-19 vaccine clinics, and we look forward to continuing to offer clinics as we move through the provincial framework. As you're aware, on Friday, the province moved our district into yellow, protect level in the provincial COVID-19 response framework. Despite our relatively low numbers, I am increasingly concerned about the state of the pandemic in our province and more specifically in our region. I do believe that our health unit should be under greater restrictions. There are many reasons for this. The variants of concern make up 58% of all cases across the province. These VOCs spread 50 to 70% more easily. Numbers are increasing across the province. The 7-day percent positivity of tests is increasing. The 7-day confirmed cases are trending upwards by 4%, not down. The 7-day confirmed cases hospitalized is increasing. The effective reproductive number is above 1, meaning the virus is spreading. The effective reproductive number in the north is among the highest in the province. I also believe there should be greater consistency across our neighboring health unit districts in terms of levels of restrictions. When one health unit has significantly lower restrictions than another, it encourages people to come and visit. That increases the risk of viral spread. When our health unit regions align, we have consistency and reduce the travel from one district to another to access services. I recognize that this is not something people want to hear, but if we don't reopen slowly, we will see a greater spike in the number of COVID-19 cases locally. The quickest path for long-term reopening is to avoid the temptation to reopen too quickly. So at this point, I'd like to ask Dr. Zimbalatti to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. On Tuesday evening, we declared the COVID-19 community outbreak at the Skyline Lancelot Apartments over. Throughout the outbreak, 45 individuals tested positive for COVID-19. Of these, 8 received a preliminary positive result for a COVID-19 variant of concern, and an additional 23 individuals received confirmation of infection with the variant of concern originating in South Africa. Sadly, 3 individuals have died in connection to the outbreak. All cases of COVID-19 in connection with the outbreak are resolved, and there are no pending COVID-19 test results for individuals associated with the outbreak. It is important to recognize the hard work and collaboration of Skyline Living Corporation, the North Bay Regional Health Center's Assessment Center, and the residents and staff of the apartment complex for their efforts to help stop the spread of COVID-19 within the apartment building. Since the update last Thursday, we have had 14 new cases, bringing our total case count to 287, with 190 in the Nipissing district and 97 in the district of Parry Sound. We have 11 active cases, and none of these are currently isolating in hospital. It is too early to tell if this is an isolated spike in COVID-19 cases or if locally we are entering a third wave. Our case counts are currently under control, and we are hopeful that with help from the public, we can prevent the numbers from increasing. Private social gatherings have been a common way COVID-19 has spread locally throughout the pandemic. No matter where we are in the provincial COVID-19 color-coded response framework, the province strongly advises that you stay home as much as possible, avoid social gatherings, limit close contacts to those you live with, or if you live alone, limit close contacts to one unique close contact household. Work from home if possible. Avoid travel except for essential reasons, and stay home if you feel unwell and arrange to be tested for COVID-19. It is important that people consider this general advice while planning their Easter activities and their April break. We ask that you do not host family gatherings with individuals you do not live with. Plan to celebrate the holiday with alternatives to gatherings, such as a virtual dinner or Easter egg hunts limited to people within your household. With that, I will pass it back to Dr. Chirico.
Thanks, Dr. Zimbalatti. Ms. McLellan, can you please provide an update on our vaccine rollout this week? You're on mute.
Sorry about that. Thanks, Dr. Chirico, and good morning, everyone. As of this morning, we have provided a total of 12,933 vaccines across the district. We continue to move forward with completing the phase 1 priorities. Retirement home residents will receive their second dose of vaccine in the next week. Community-based healthcare workers are beginning to receive their first dose of vaccine. And as it arrives, the vaccine allocated to our Indigenous populations is being distributed for use. Plans for immunizing those who are receiving chronic home care services are currently under development. This week, we began immunizing our 80+ population. Clinics are being held across the district and have gone very well so far. There have been a few challenges with the provincial appointment booking system. The system has allowed individuals to overbook appointments beyond the clinic's daily capacity. However, I know with 100% certainty, every person who had an appointment has received their vaccine. We are implementing measures to ensure that we're aware of the total number of booked appointments, not just the number of appointments available at a clinic, so we can ensure that we have sufficient vaccine at every clinic. This issue is not unique to our health unit, and we cannot alter the system itself. However, we have reached out to the province and they are aware of the issue, and we are hopeful that this will be rectified soon. Finally, I'd like to confirm that our clinic for our 80 population scheduled for this Friday, March the 26th, has not been canceled. We understand a number of individuals have received calls canceling their appointments and directing them to alternate clinics within the district. I am confirming that our clinic will run as scheduled on Friday, March the 26th from 9 a.m. to 4 p.m. Anyone who has a booked appointment at that clinic is to come at their scheduled time. And with that, I'll hand it back to Dr. Chirico.
Thanks, Mr. McLellan. We've also been advocating with the province to increase our allotment of COVID-19 vaccine, and our member municipalities will be supporting our efforts by advocating for greater access to vaccine in our district. Earlier, the province increased supply allocation to pandemic hotspots in the province. That meant a reduced supply for our region in previous months. We'd like to keep on pace with the rest of the province, which has announced the commencement of vaccinations for those 75 to 79 years old. We don't have enough vaccine supply to open up to this cohort. We're hopeful the province will adjust the allocations to make up for the shortfall. As soon as we receive vaccine allocation from the province, we have the clinics available and ready to get the vaccine into arms of those who need them. So that's it for our prepared remarks. And now we'd like to begin answering your questions. So if you have questions, please type them into the Q&A at the top of the screen, and our moderator will read them out loud, and we'll try to cover off as many as we can. So Alex, if you could please start with questions.
Perfect. Our first question is directed to Andrea. It is from Eric Thompson. Why won't the health unit be providing vaccination numbers for specific clinics or municipalities?
What we're doing is providing an overall summary of the vaccine rollout and the number of people immunized across our district. And I think that's consistent with how we have been handling our reporting of cases across the district as well.
Thank you. Our next question is from Clark from YourTV/Cogeco. People in the area are concerned with the lack of vaccine availability for our region. Do you think we are still on track to get everyone vaccinated by midsummer? Andrea?
I believe that we can do it, provided we are provided with the vaccine supply that we require. As Dr. Chirico indicated, we continue to advocate with the ministry for an increase in vaccine availability to allow us to get caught up to where other areas of the province are. And hopefully that vaccine will be provided to us, and that will allow us to get more vaccine into arms and meet that target.
Thank you. Our next question is for you, Dr. Zimbalatti. Were the increases in cases over the weekend linked together? When you list that they were travel related, what does this mean? Was it out of province, out of country, or out of district? This is also from Clark from your TV.
Thank you, Clark, for that question. By definition, out of travel related to a COVID-19 case is travel outside of the province. So it could be related to either out of country or out of province travel. And there were some clusters around those travel related cases.
Thank you. This question was submitted anonymously, and it's for you, Dr. Chirico. Dr. Chirico, if you were to shut down children's soccer fields this summer, how would you do that? Would it be a Section 22 under the HPPA?
Well, I think it's really premature to be able to look forward to the summer. As we all know, that this pandemic evolves and changes quickly. And so we have really no notion as to exactly what the summer situation will be. But what I can say, and what we do know, is that a lot of this is under our control. And if people act now and act with really good judgment to only go out for essential reasons, to physically distance, to use face coverings, to really be mindful that these VOCs are spreading, to be mindful that anytime you increase contact with other people, you increase the risk of spread. And I continue to reinforce that we are not an island. So we have to look beyond our own district and communities. And so we really need to resist the temptation to be doing any traveling. We need to only go out when it is essential. By doing that, the best advice I can give is that if we act now and reopen really slowly, we have the best chance to have a sustained and long-term reopening so that we can enjoy the summer activities and soccer for our children.
Thank you. This question is for you, Andrea. It comes from Jennifer from the Nugget. When will high-risk individuals with chronic health conditions be vaccinated?
That group of individuals falls into phase 2 of the provincial immunization strategy.
Thank you. This question is directed to yourself, Dr. Chirico. It's also from Clark from your TV. Will Dr. Chirico push Dr. Williams to increase restrictions in our district?
We work with the government hand in hand. And to that point, yes. My job is to assess within our district and provide an honest account of what I believe would benefit our communities. And my primary focus is on the health and safety of those in our communities. I can provide the recommendation, but it's ultimately up to the government to make the final decision.
Thank you. This question is for yourself, Andrea. It comes from Brad from Moose FN. Folks have been told that the current clinics in West Nipissing, North Bay, Mattawa, etc. are full, and we're told to drive to Temagami for their vaccine. Do we know when the next shipment will be in? What is the health unit's stance when it comes to traveling for the vaccine? And do they join the wait list or drive to North Bay?
I'm not aware of anybody being directed to Temagami. That's definitely not coming from the health unit, and nor is any direction to travel anywhere. Vaccine clinics may be full based on the bookings that are available. We will continue to offer clinics on an ongoing basis, and individuals will be able to book into those clinics. We receive a vaccine allocation on a weekly basis, and we will be scheduling clinics based on that vaccine allocation once we know what it is, so that we can ensure that we have sufficient vaccine for the clinics that we're holding.
Thank you. A question from Eric Thompson. The province announced that 75-year-olds could start booking vaccination appointments last week, but the North Bay Parry Sound Health Unit wasn't ready to start this process. Can you explain the miscommunication?
I certainly can. When the province announced that, it was a statement made in general for some of the areas that were ready to move into phase 2 of the rollout of the vaccine. Our district is not ready to move into phase 2, and so we're encouraging people to allow the 80 plus population to receive their vaccine as part of the phase 1 rollout, because we're not in phase 2 yet. Unfortunately, the communication provincially did not identify that there are many health units who are not ready to move into the 75 population, and so therefore the system is open, and there are areas that are doing them. In our area, we are encouraging the 75-year-olds to wait just a little bit longer, so that we give the 80 plus population the opportunity to get their vaccination first.
Thank you. Another question for yourself, Andrea. It's from Eric from CTV. Can the health unit confirm why individuals received reports that the Friday clinic was canceled?
Yes, I can. That was done by the ministry proactively in error. What happened was there was a glitch in the system, as I indicated earlier, that was allowing clinics to be overbooked. And in order to ensure that we had sufficient vaccine for all of our clinics that were booked for this week, we asked the ministry to close the booking of clinics for the rest of the week, because they were mostly full anyway, to ensure we had the vaccine available. And so the ministry thought that we closed because we were overbooked, and so they started calling people and canceling appointments to try and get the numbers in the clinic back down to where they should be. It was completely an error and a miscommunication. We followed up with the ministry yesterday, and there are no longer any calls being made. And we have sent out a news release to individuals. And as I indicated in my opening remarks, that we are encouraging the public to show up for their appointment on Friday as scheduled. The clinic is running.
Thank you. Our next question is from Sarah Cook from the Parry Sound North Star. How does people leaving the area to receive a vaccination in other jurisdictions, example those under 80 and going to a pharmacy elsewhere to receive a dose, or those coming here, such as those over 80 with primary residence elsewhere, impact where the province allots the vaccine supply? Andrea or Dr. Chirico?
Vaccine is allocated based on a population-based criteria, but the ministry has access to the provincial database, and they have access to the information as to where people are immunized and where they're actually from. And we also have the opportunity at meetings that we attend with the ministry to let them know if we're noticing a trend of individuals from outside of our district coming to our district, and that could impact our overall allocation of vaccine for our area.
Thank you. Our next question is from Chris Dawson from Bay Today. Can you update where we are in the process of getting pharmacies and doctors' offices to help with the vaccination?
Sure. There's a provincial pilot happening at this point in time in Southern Ontario in pharmacies and primary care areas to look at how vaccine can be rolled out using pharmacies and primary care offices. There has been an email that has been sent out across the province to primary care locations and to pharmacies requesting information on an expression of interest for having vaccine in the pharmacies and in the primary care offices, and the ministry would be providing guidance to those areas that are selected for vaccine administration as to who the populations that they would be immunizing would be with the vaccine supply that they are provided with.
I'd also further add that we were working and have been working with pharmacies within our district as well as primary care, and working with them in anticipation of their involvement. And we are certainly ecstatic about their involvement and being able to provide vaccines to their patients and clients.
We've also had some, sorry, I should have mentioned this as well. We've also had some interest from primary care offices to host smaller clinics in their office for population groups if that would be helpful. So for example, you know, offering clinics for 80-year-olds and over. So we're working with our primary care areas and our pharmacies to ensure that when and if they do have access to vaccine, they're ready to go. They need to be trained in the database that's available and things like that. So we're wanting to make sure we set them up for success and for speedy access to this process when it's available.
Thank you. Our next question comes from Jennifer from The Nugget. Has there been any issues during the mass vaccination clinics, such as medical issues after an individual has received their vaccine?
No, we haven't had any issues at all. Just very, very thankful people and very happy people to have received their vaccine.
I will add to that we are monitoring any adverse reactions to vaccines. All of those reports would come to the health unit, and so far in relation to the COVID-19 vaccines, they've been quite minor.
Yes, and to add to that as well, most of the reactions that have been reported, I mean, millions and millions of doses have been given around the world, and most of it is just a localized reaction, some pain and swelling, redness, and feeling a little bit unwell when they do have the side effects, and they're transient, meaning they do go away reasonably quickly.
I should also mention that we have paramedic support at all of our mass immunization clinics in the event that there is an issue. And at some of our clinics, we actually have physicians who are there assisting with immunization as well, who would be available to support if there were any reactions that happened within the clinic.
Thank you. Our next question is from Greg from North Bay Local, and this would be directed to yourself, Dr. Chirico. What do you make of the province's decision to place our district in the yellow zone? And would our zonage align with the provincial rate or our rate of vaccinations?
I'm sorry, the last part I couldn't hear, Alex.
Sorry, and is the designation aligned with the safety afforded by our vaccination rate?
As far as the designation into the yellow, I think that's a question that certainly you would have to ask the ministry as to why we were allocated into that zone. I've indicated previously in the preamble exactly what my concerns were and why I felt that we should be in a much more restrictive zone.
Thank you. And for yourself again, Dr. Chirico, Eric from CTV is wondering which color do you believe we should be in right now and why?
I believe that we should be in a more restrictive zone, and I believe that based on what our surrounding districts are, that I would feel much more comfortable if we were in the red restrictive zone. And for all the reasons that I've mentioned previously, that taking into consideration the variants of concerns, how quickly that they are taking over the normal COVID-19 that first originated, the ease of transmission, looking at how the numbers in the province, as all the things that I had mentioned previously, for all those reasons, that is why I feel that more restrictive measures. And it's important also to re-emphasize that people will travel if there are different restrictive zones. and they'll go to less restrictions. We've experienced that in the past and currently. And so if we are attempting to get control of this as quick as possible, and I know it's not what people want to hear, but if you limit your travel to essential reasons only outside of your home, and not be visiting other people, and staying in alignment with the public health restrictive measures and recommendations, if we do that now, we will be able to have a longer and more sustained reopening, but we have to act now, because within the province, the third wave has started. Even if our numbers aren't there yet, we need to be preventative.
Thank you. Our next question is directed to Andrea. It comes from Jennifer from the Nugget. When are we scheduled to get our next vaccine shipment, and do we know how much?
We receive vaccine on a weekly basis. Our next shipment is due on Monday or Tuesday of next week, and I don't have a confirmed number. I have a tentative number of doses that we will be receiving.
Thank you. This question would also be for yourself, Andrea. It's from Brad from Moose FM. What happens if individuals in the 75 to 79 age group end up getting a vaccine appointment due to the miscommunication? Are folks turned away at the door?
No, they are not turned away. If they have a confirmed appointment, they are immunized.
We're just asking that people do be COVID kind and do recognize that there are other priorities that we do need to address, and that please hold off. If you are in that 75 to 79 age group, hold off and let the 80-plus-year-olds get the appointments.
Thank you. This question would be for Dr. Zimbalatti. This was submitted anonymously. There's a case listed as outbreak associated. Is there an outbreak in North Bay?
Currently, there are no outbreaks in North Bay.
Thank you. This question would be, I think, directed more towards Andrea, but possibly to Dr. Chirico. Can Dr. Chirico elaborate more on the vaccination rollout, as both Sudbury and Algoma are able to book 75 to 79?
I would assume it would be based on their vaccine allocation and how they're progressing through the rollout overall. Like you say, the system will allow you to book 75 to 79-year-olds. We don't encourage it. We really are wanting to get follow the sequence and the vulnerability that has been identified by the ministry. But if a 75 to 79-year-old has a scheduled appointment, that appointment will be honored and they will be immunized.
And I'd follow up with that to say that, again, all we can really identify is the situation that we're in. The situation is that we're playing catch up. And because there was a month-and-a-half delay, and when we first did get a vaccine, which was January 26th, and then the next was February 22nd, and they were in simply because there were shortages, and we all recognize that, and that was the reality. It was nobody's fault, it just happens. And it went to areas that had most needs. So we're still playing catch up. And by putting the 75 to 79-year-olds into the queue means that we would require approximately 5,364 more doses. So it has implications as to what we're able to do.
Thank you. Our next question is for yourself, Dr. Chirico. It comes from Jennifer from the Nugget. She would like Dr. Chirico's reaction to the province opening up restrictions for restaurants in the gray and red zones.
Yeah, as far as that goes, I still maintain and recommend that the more interactions that occur, the more risk there is to spreading the virus. My personal belief is that we need to limit our interactions We need to go out only for essential reasons. And if we act now and act early, it's been shown that it's very, very effective at having a sustained reopening. So that's my recommendation.
Thank you. Our next question comes from Chris from Bay Today, and it's for yourself, Andrea. What percentage of the regional population is anticipated to be vaccinated by the end of the week?
I'm not sure I understand are we talking specifically about 80-year-olds or the general population? I'm not sure I understand the question, Alex. Can you read it again?
What percentage of regional population is anticipated to be vaccinated by the end of the week? We will go with the vaccination clinics, so our 80+ group.
Okay, I would say based on the data that we have of approximately 7,100 individuals in our district, and bear with me through my math, we will have immunized, based on the clinics that we have, approximately between 500 and 5,500 people in the 80+ category. So more than, I'd say maybe 70% of the number that we're working with.
Thank you. And
sorry, Alex, can I just add there are more clinics planned next week as well for 80+.
Thank you. And Chris just added that he was looking for also the percentage of our general population that would be considered vaccinated by the end of the week.
What we could do is gather all those numbers so we can get some accurate figures to you and respond afterwards, if that's okay.
Our next question is for Andrea from Jennifer from The Nugget. It's a follow-up question, and she's just wondering when the date or the projected date that we will move into phase 2 for our vaccine rollout will be.
Mid-April, I would suspect. Based on the current allocation of vaccines and what we anticipate in the next week or two, I would say mid-April.
Thank you. Our next question is also from Jennifer from The Nugget. I know there was a call out for volunteers to assist with the mass vaccination clinics. However, hearing now volunteers are not required. Is this correct? Andrea?
I know that, but we have volunteers working at our clinics, and I believe they are being scheduled in as required. And we definitely have been using volunteers at the clinics, and so I'm not sure about that. Other than that, sorry.
I could add to that. The call out to have volunteers, we're looking at a sustained period of time that we're going to be doing these vaccination clinics. So we welcome people to volunteer. We may not be able to use them specifically right away because we have been working to get volunteers for quite some time now. So we have a base that we're using, and we anticipate that there will be plenty of opportunity to, when we move forward, when we get more vaccine, and to be able to do it on a much more consistent basis. So yeah, we do encourage people to volunteer. We do have a screening process that we have to go through, obviously. But yes, we really very grateful and thankful for all the volunteers that come forward. And this is going to continue for months. So we thank them.
Thank you. So we have no other questions submitted, so this will conclude our press conference for today. We will be back next week on Thursday at 10 a.m. and you can find the recording on our website along with the facts and figures for Chris's question. Thank you very much. Have a great day.